Hey guys, for those of you that don't know me, my name is Catherine Maslin. I am a naturopath, nutritionist, author, founder of Shift, and also host of the podcast The Shift. And I wanted to do a little video talking about IBS, or irritable bowel syndrome. And if you've listened to the Shift podcast, we talk about this quite a lot, I think in episode 3 from memory. But the thing with IBS is that it's a bit of what we like to call a diagnostic dumping ground. Now, what that means is that often you'll go and see your doctor or your gastroenterologist. They'll rule out other more sinister things, perhaps things like celiac disease or Crohn's or ulcerative colitis. And they can't find out what's wrong with you, so they say you have IBS. IBS means irritable bowel syndrome. It literally means your bowels are irritated. So in my opinion, that's not a diagnosis, okay? Because it doesn't really tell us the underlying issue of what is happening. So the question we want to ask ourselves if we've been diagnosed with IBS, why are my bowels irritated? Why is my gut irritated, okay? So why am I having symptoms like diarrhea or constipation or cramping or bloating? Why is this happening? Okay, and there's many reasons behind this, and a lot of them, unfortunately, your gastroenterologist doesn't have the tools or expertise to look at. So gastroenterologist, amazing if you have inflammatory bowel disease or something quite sinister going on. Not so great when there's a state of imbalance in the gut, okay? And this is because in the medical model, they're not really taught to treat imbalance and allow your body's natural healing process. It's more of a symptomatic management state. So with naturopathic medicine, the way that we look at things is taking more of a holistic view, okay? We're looking at the landscape of your entire health. What are all the pieces of you and how does that fit in? And when we're looking at gut health particularly, what we're interested in at Shift is what are all the different pieces of your gut health and how do they relate to one another? So for instance, if you have hypochlorhydria or low stomach acid, what's going to happen as a direct result of that? You're going to end up with more bacteria in the small intestine, maldigested food, which is going to cause inflammation in the lower intestine, and then this is going to cause symptoms down the line. So a problem that starts up here ends up being a problem lower down in the gut, right? One thing leads to another. So if we can understand the health of the entire gastrointestinal system, we can then begin to make decisions about treatment and what's really going on. So if a patient comes to me and they're diagnosed with IBS or irritable bowel syndrome, my first thing is to look at doing a comprehensive digestive stool analysis. This is quite different to the test you'll get done through your doctor, which may look at inflammatory markers like calprotectin, may look at things like Giardia and potentially parasites as well, but doesn't really look at the landscape of the microbiome and what is happening in your gut. So the first thing I want to know is what are the bugs in your gut doing? Because in your gut, you have 2 to 3 kilograms of bacteria, yeast, parasites, archaea, and these bacteria and yeast in your gut have a massive role in the health of your gut, in controlling inflammation and how you're actually going to react to the environment or the food that you put inside of you. So when we're doing this testing, the aim is to really understand that landscape of the gut and look at what are your microbes in comparison to one another, what's low, what's high, do we have any dysbiosis, which is imbalance in these bacteria, are there fungal overgrowth, is there anything like that going on, are there any inflammatory markers, what is the immunity of the gut look like, are there signs of maldigestion? So then we have this document, right, that gives us this idea of the landscape of your gut. That paired with the symptoms you're experiencing gives our team enough to be able to actually move forward and look at treating some of these underlying factors of IBS. The other really big component of IBS and any gastrointestinal condition, in my opinion, is stress and your nervous system. So if you're experiencing stress, anxiety, etc., that is part of the landscape of your gut health, and it's something that you need to have a look at. So if you've been diagnosed with IBS, don't leave it at that. Look at seeing a really good naturopath or potentially integrative doctor, someone that understands gut health and can have a look at what is all of the pieces going on for you and helping to heal it. And when it comes to treatment, again, with the medical profession, they don't have a lot for healing gut complaints, things like dysbiosis or even mild inflammation or anything like that. It's really looking to nature for cures for this. And this is where herbal medicines have a really prominent and amazing role. We have herbal medicines that heal the mucous membranes of your gut, that increase stomach acid, decrease stomach acid, increase bile flow through the liver and gallbladder. Herbs that help to support pancreatic enzyme output, herbs that help to improve improve peristalsis, which is the movement through the gut, to relieve constipation, right? So if we know what these issues are, we can put this right combination of input of herbal medicines to help your body to heal. Concurrently, we're going to be using herbal medicines to help with stress, right? Herbs that are anxiolytic, they calm anxiety without side effects or making you drowsy. They're helping you to sleep. They're helping you deal with stress day to day. So you can see that if these things exist, which they absolutely do, and you use them in the right way, the body has an amazing capacity to heal itself. So when I see patients struggling with IBS, or people out there and they're in our groups and they're, giving this feedback of, yeah, I have IBS, but that's just it. I've tried cutting out dairy, I've tried doing this, but they haven't been able to get to the bottom of it. We need to find out why your bowels are irritated, right? Because that's going to give us a clue of how to get in there. And perhaps the solution might not be easy. You are probably not going to fix an IBS type syndrome in a couple of weeks, but over a few months, totally, you have a really good chance to make an impact in that. So let me know. Is IBS something that you've been diagnosed with? Has that been your experience where you've seen a doctor and it's just sort of something that's come up? I would love to hear from you around that. And if you would like help with your IBS, you can work with our team. So the way that it works here at Shift is we do an initial discovery and diagnosis session. It's 90 minutes. It's with myself or our other naturopathic team. And what the team does is that we'll look at your entire landscape of your health. What is all the testing you've had done? What are all of your signs and symptoms? What is your personal health story? What are you eating? How is that making you feel? And from that information, we can then give you a naturopathic diagnosis, which is understanding all the pieces of you and what you need to do to move forward. You'll get dietary lifestyle advice in that initial consult as well. So heaps of value. If that's something you're interested in, you can totally book that in. Just reply to us and we'll get back with you with some info. Then from then on, you might want to continue the journey with us and even become a member of the Shift Clinic. So I hope this has helped you. Any questions at all, let us know, and I will see you guys soon.